Listen up, get ready, I'm not gonna take no more. There's a revolution, a revelation going on in my soul. Buckle up, get ready, we're not gonna sit back.
Okay, Euan, how about you introduce our first guest?
Yeah, this is Katie Clark, who's the doctor nurse practitioner and works at the Augsburg Health Commons. We met about 6 months ago at a conference actually in Baltimore about community engagement. And I really thought that really interested in the work that Katie had done at the Health Commons. And then we stayed in touch. And obviously the last month has been really dramatic. And she's on the front lines of healthcare in Minneapolis. So Katie, welcome to the program. Thanks for joining us. Just tell us a little bit about what a normal day would be like and what the Health Commons is.
Sure. Thank you so much for having me. I'm so excited to be here and be in this space. It's so important. So I'm the executive director of the Augsburg Health Commons and have been in that role now for 17 years. And as you can imagine, being in Minneapolis, I've been in the community now for some, we keep using the word unprecedented times, but just when we think things are getting back to normal, things seem to shift. So my work at the Health Commons has really been both as a faculty member, and I started actually as a student, but the Health Commons are health-focused drop-in centers. They're located in various communities in the Twin Cities, as well as other universities are replicating them, actually one in the Chicago area right now. So really what they're focused on is it's not a clinic. It's not meant to be. It's really grounded in local context and asking community members what it is that they need instead of us as the experts from the outside deciding where the deficits are, and really focus on building those relationships and really thinking about how when we are socialized into our professions, how much we tend to other people in a normal way without meaning to. And so what are we doing to blame people for their problems? And when we're talking about social determinants of health, what does that actually mean? So we use this phrase of decoding systems of oppression. So I'm there as a faculty member with students from various programs, not just health-focused programs. And really we're there to give people, whether it's socks or underwear, hygiene products. They can meet with a nurse one-on-one and get blood pressures or their foot care done. But really, it's a time to get together where people can come in without proof of need. They don't have to have an ID. They don't have to have insurance. They can just come in and simply ask for what it is that they need. So the first Health Commons was developed in 1992, and it was in response to modern day homelessness. So that one is still in existence, and it's in downtown Minneapolis. And so most of our guests there are unsheltered. And so we stayed open at that site during COVID. George Floyd was also a person who had frequent the space. So you can imagine the compounding impact that had on that community. So we shifted our services. I focused a lot of my time going to the local encampments and providing care there and partnering with other groups, whether they are service agencies or mutual aid groups, and ensuring that people got their basic needs met. And then in 2011, we started our second Health Commons. I started that one with two other Somali healthcare providers in the high rises in Cedar Riverside, which is the most condensed area of Somali immigrants outside of Somalia itself. And so I think Minneapolis has been very much in the news based on that very neighborhood that the Health Commons is in. So we're in the high rises in two different spaces, one predominantly for males and one for women in providing services. And then we have other spaces as well.
Mm-hmm. So the last month has obviously been quite a dramatic time. What are you seeing amongst your guests and on the ground in the community there?
Yeah, so every space has its own issues, but I would say for the one with the unsheltered community, we have a lot of Spanish-speaking families come in. We haven't seen them. So we've tried to shift our services to be able to bring things to people where they're at. But there's also been a lot of risk in that because people have started to be followed. And so are we bringing people to those spaces? And so if you ask anyone in Minneapolis, they've probably had an encounter in some way or another with the presence of federal agents in Minneapolis. And so just going to work, I have seen things. I I was trapped in what they're calling an ice raid, where I was in my car and I couldn't go forward and people were being pepper sprayed. There's a lot of violence in rhetoric and well as in violence being physical force. And yeah, it's something you can't unsee. So in the Cedar Riverside community, I would say the presence, we don't have as many layers of security as we do at being at the shelter. And so we've had to close because a lot of our coworkers are Somali. And so the day that Renee Good was shot, I was there with my Somali colleagues and they all left. They just left and said, please close up. Now a white woman has been killed and nobody is safe. And so we've really had to shift too and start questioning, like, what are the rules and what assumptions have we been making about being open, that maybe those rules don't apply anymore. And so, like, how do we still show up and do no harm as best we can and sometimes harm is not showing up. And so it's been this fine line of wrestling what to do. But so we have shifted some of our food services to be able to walk with people to their apartments, maybe pausing on students based on what's going on. But a lot of it is just ICE agents asking people for their passports or proof of citizenship and things like that.
Let me ask, how has ICE activity impacted your health commons?
I would say we've had to close some of the locations because we haven't been able to, we don't have enough staff. So sometimes some of the locations we have, I am the teacher, the security, the everything. And so that's been a tough one to really figure out how we do that. And so we've closed some of our locations.
Mm-hmm. So it's a total disruption to everyday life.
Oh, yeah. And their numbers are down. People aren't going to their doctor's appointments. People are coming in with very urgent medical needs that I can't address because we're not based in a clinic set model. We're more just showing up. So we have new people come a lot who don't want to show their documentation. Literally last week, a 10-year-old came in the location where it's part of the day shelter by herself. And she was of Hispanic descent. She came in and said she needed diapers. And I'm like, where's your parents? And she's like, they didn't want to come in. So like the best idea was to send a 10-year-old into a day shelter because there's more than us just going on there. And so those are like the realities. And then you just see people's mental. So we see a lot of severe and persistent mental illness, as you can imagine. So last week we had a woman, she was white. She had a wound. You could smell it, odorous. She needed to go to the hospital. She thought I was ICE. She was paranoid that I was ICE. And so I had a different person try to talk to her and say, maybe we call an ambulance. And she ran out into the freezing cold with no hat and mittens on because she was petrified that I was ICE. So you see people really being re-traumatized from a lot of the things that happened also during George Floyd and the pandemic. And so, I worry about the long-term implications of this because everybody's not everyone, but people are paying attention right now. So what happens in 6 months when hopefully this is better and people aren't paying attention, but we still have these compounding, not only are people missing their appointments and maybe needing to, whatever their condition is worsening, but the mental health issues around this. Mm-hmm. It's really concerning, especially as looking at it from like a nursing perspective.
Mm-hmm. I think one of the things that we've all seen, and we've seen it ourselves in our own Chicago neighborhood and across the city of Chicago, has been the community response. And so, obviously there's been these traumatic events, but one of the inspiring things has been the response of the community, and you're embedded in that community. How does that community response make you and your colleagues and your guests feel?
I mean, it is beautiful. I mean, it's really beautiful. Like, for example, one of the things that we do for food distribution is I stand outside. You're in Chicago. You know how cold Minnesota is. We've been in the negative degree. So I stand outside the whole 2 hours and just watch, just in case anything were to happen. I warn people, whatever. People bring me in the Somali neighborhood, Sambusa, Somali tea. They roll down their windows and they say, thank you. You see communities going out and just walking around and trying to make sure that if anybody sees ICE, that they're using their whistles and they're recording things. You see people organizing through mutual aid, gathering money to make food for people who are trapped in their homes. And now you see people who are not only trapped in their homes, but needing food, but let's send them something to do, artwork. What can we do creativity wise? They literally aren't leaving their homes. And so it's very beautiful in that way. And then the other thing, for example, and I'm sure you also saw this on the news, the Cedar Riverside was, a big centerpiece of this anti-Islamic protest that was scheduled to happen in Minneapolis. And so those of us in the area gathered and talked about a security plan and what we're going to do. And the community was like, we don't want you to show up. We don't want anyone to be here for whatever it is that they're going to do, to react, to ensue violence if it might happen. Let's leave. Let's just leave. And so everybody left. Nobody came. And I couldn't believe it. Everybody was listening to the community members. And I did not see that during George Floyd. I saw that now. And I think everybody is clearly on the verge of feeling very helpless at times. But people are really coming together. They're checking in on each other. They're singing songs. They're, coming together in prayer. But I also think people are tired. We're really tired now. And everyone keeps saying the last month, this has been going on since the beginning of December. Mm-hmm. It's just that it's, gotten worse and now is getting, thank God, the public attention that it should, because it doesn't feel like the same place I was living in November.
Katie, can you give our listeners and viewers a little information on the development of the Somali community? How long have people from Somali, where there was a civil war going on and good reason for them to come to the States, how long has that been there, and how has it emerged, and what role does it play in the overall composition and energy of people of Minneapolis, St. Paul?
Sure. And I'm not a historian on all these things, but I've learned a lot from the community. And we actually have some oral histories with community members, including the doctor I started the Health Commons with, who is the director of community health in Somalia. And it is fascinating to just learn how people ended up here. But my understanding, it was in the 1990s, and people came to the U.S., most of them through either sponsorship or refugee status. And a lot of people ended up in Minnesota first, not so much in Minneapolis, but more in the outskirts where there was jobs. And then people also discussed that coming to Minneapolis, either they had a family member here who might sponsor them, or also we have great services and benefits from Lutheran social services and Catholic charities, and other state benefits that are really helpful for people who are in a time of need.
Which is larger, the Somali community or the Latino community?
That's a good question. I'm not sure what the answer is on that.
Mm-hmm. Are people pretty cooperative? I mean, we get a really good vibe from what we see and hear from Minneapolis, St. Paul. And I guess I'd also a little curious about your take on elected officials and how they've responded. From our end, it looks like they're the best. Maybe you could fill in some details.
Yeah, I mean, you see them describing the things, and it makes me so proud that they're not just, to be honest, even coming on here today has risks for me, my family, my institution, the Health Commons. So speaking out bears a lot of risk right now because of what's happening. People are getting death threats, amongst other things, when they say certain things. And so for me, I'm very proud, and they're not wavering. I think for me, sometimes when I am in community, the one thing we see a lot of local city elected officials there, but there's been times where I've been where are our big politicians, and where are those people? Why aren't they here now? This sounds quite dramatic, but I love the civil rights era. Where's our Martin Luther King? Who's here showing up in the heat of things? So yeah, I've been impressed and I've been inspired and I've been very relieved as of the last week or so in hopes that things are coming to an end because of them speaking out.
In terms of speaking out, you recently published a blog on the Nurseology website entitled Call Them Somali Americans. And you talk a little more, going back to the history, about the impact of the rhetoric and what you mentioned earlier, the kind of othering of the Somali American community. I was wondering if you could just reflect a little bit on what you wrote and that background about how things like the so-called Muslim ban and other events and the kind of language that has been used to describe the community really impacts on people.
Yeah. So when we first started in 2011, I got to learn a lot about just the level of Islamophobia that I was not always aware of, especially when you're wearing something like a hijab. And so I remember I was actually teaching a class when the Muslim ban happened, and in my student body, we had many students in that class who are graduate nursing students who are of Somali descent. And I remember we kind of thought Hillary was going to win at the beginning and then slowly realized it was Trump. And the students were crying. They were crying. They were like, am I going to have to leave? Am I not going to be able to practice my faith? Like, the fear of it all was very real and the uncertainty. And so those things have kind of just become something that is normalized, that it's okay, that we don't continue to fight back. And now I feel like the words around the Somali community are just so absurd and inaccurate and criminalizing people just based on who they are. And in our communities, you'll see people driving around and just yell out, go back to where you came from. And it's a student who's not even Somali they're yelling at. So it's become almost okay to do these things. And I've just, my good friend who's my colleague at the Health Commons, she said the number one thing she's scared to do is fill up her gas tank. She was born here. Like, she's scared to fill up her gas tank. So like, those things are real. Or leaving your kids home alone because they come to and knock on your door and don't have reason to, is my understanding. So, it's been really, really hard to see this hate, but it also has been really powerful to see people rise against it and say, this is not okay.
I'd like to ask you a little bit about nurses and their role in the country, because they seem to be a progressive lot. And there's a national union, I believe, and we've had a strike in New York. I have comrades from my earlier Rising Up Angry days who have gone on to be real active in nursing and in nursing politics. What can you share with us about you becoming a nurse, why you became a nurse, and what you have to say about maybe leaving laud nurses in general?
Sure. Okay. Yeah. No, I think my mom grew up very Irish Catholic in the south side of Chicago. And so a lot of what I grew up was reading and hearing about Mother Teresa. So you should go help in other countries. So I did just that. I volunteered a lot as a nurse globally, and kind of began to question my role there and what are we doing? Are we kind of promoting a monoculture? Do we know what their health practices are that we could actually train people instead of kind of making everyone think the Western way is the way? And so I began to really question those things. And I started learning about this transcultural nursing perspective, which my degree is in, and it's really anthropology and nursing. And so through that, I started working with the homeless youth population here in Minneapolis, and then now more the adult community. And so for me, I never thought I'd leave acute care setting. I love working in the hospital, but there's so many aspects to nursing that you can do and be a part of what's going on. So not many people can say, I'm a nurse and I got to, do these different things in real time because of what my role is. Nurses are powerful. Lillian Wald is the founder of public nursing, our public health nursing, and she talks about that nursing is love in action. And so I see that now. I see a lot of people coming together. When Alex was murdered, there's been so many vigils and so many people saying this is not okay. And so I hope that continues. But I think it also was incredibly emotional. Every single nurse I know was in tears. Like, how could this be? Like, how could this be? But also any nurse that would probably have been there in that moment would have done the same thing, seeing a woman getting knocked over. And so I think we need to start questioning when people want to oversimplify something to be so political into a quick snap narrative of what would we have done? Because I think a lot of us would have done the same thing. And we all know that he's actually not the words that others have decided he is, right? And so I hope an apology happens to his family, because that is not all right.
In your piece in Nursology, you talk about the emancipatory power of community building and nursing. I was wondering, how do you build strong communities and empathy for all at the Health Commons and beyond?
Yeah, I think the number one thing that we do with that is really thinking about what we center as knowledge, and thinking about empirical data is really important sometimes, but we're not centering people's expertise and living in the margins or living as a new immigrant. And if we're not expanding on people's lived experiences and what we're deciding to do, then we're just doing more of the same, of this commodified health experience, which we need to get away from. So how can we really develop those relationships where people know their power and their agency is just as important as what we might provide for them in terms of you need to take this medication or whatever it might be. And so really centering that shared humaneness and helping students clearly identify that. I was watching a video about you actually, Euan, and it was you talking about being in communities and the placing place at the center of all the things you do and how students change because of that. And I think that's exactly what we do at the Health Commons. Right. And we don't extract and we don't oversimplify. We really stay in these committed relationships for the long term. And the community sees that, right? And so that's what it means to me, really getting rid of the shackles that have really put the constraints around not only who's privileged in certain circumstances, but why are they privileged in the first place? And how can we change that narrative? Because we're not going to be able to address health inequities or social determinants of health if we don't understand those root causes. And so it's hard to get to those conversations sometimes. We have to debrief afterwards. You just saw this happen. What does that mean? And so it's really great to see the students change so quickly and just understanding what they didn't see before.
Yeah, and I'm going to flip this back to Mike. 50 years ago, Mike, with Rising Up Angry, one of your most successful programs was your Free People's Health Clinic.
Yeah, there was the Black Panther Party initiated it, and the Young Lords had one, the Young Patriots had one, and Rising Up Angry had the Free People's Health Center, Fritzie Engelstein Free People's Health Center. And, they were pioneering outfits. I did want to ask one more question. I only got about 2 minutes left. Katie Clark, I noticed that you guys were looking for donations for socks, for hand warmers, for underwear, deodorant, diapers, bags, all kind of things. Are you still in need of those things? And is there a place people could look to see and maybe send some things?
Yeah, we have a list of donations on our website for sure. And so all those things are totally amazing if you're able to contribute. Everything at the Health Commons is based on kind of what we raise. So, yeah, it's...
So that's
what's your website for the listeners and viewers?
Augsburg.edu/healthcommons.
Yes, that's it.
Well, thank you so much for coming on the show, and we hope to meet you in person. You're doing great work. The people in Minnesota are inspiring people around the country, as are, I think, people here in Illinois. We got a great country. We got to protect it, and we got to save it. I want to thank...